I'm honored to introduce Dr. Tyler Cowen, who is an economist and the co-writer of the very, very popular Marginal Revolution blog. He teaches at George Mason University, and he has been on the forefront of commenting and doing research in COVID-19. And he's going to give us the keynote speech on basically on policy in pandemic, on the public perceptions of the powers of the state. I'd like to take a minute to thank and welcome Dr. Cowen.
Hello, thank you for having me. Hello, everyone out there. Thank you for listening. I would like to thank Center for Civil Society and Parth Shah. I have spoken in person at many of these programs in the past. I'm sorry I cannot be there right now, but I think you're all doing great work, and please keep it up. So I'm speaking from my home in Northern Virginia. My wife and I, we seem to be healthy and we're doing fine, and I wish the same for all of you. Now, to turn to the topic, I would like to consider public perceptions of government, the state, in the United States, because this has evolved in a very strange and unusual way. But let me step back from COVID-19 for a moment and just tell you a simple story. So when I was a boy, my country, the United States, we, of course, put a man on the moon in 1969. And President John F. Kennedy had announced in the early 1960s that we would, over the course of a few years, put a man on the moon. At the time, many people did not believe this was possible. But in fact, of course, as we now know, the United States did this more or less starting from nothing, from scratch, in about 7 years' time. That is a form of what I call state capacity. The state is able to get something done. Now, people disagreed. Was it worth spending all that money to put a man on the moon? That's a very worthwhile debate. I won't consider it, but it is striking to me that the United States federal government did in fact get a man on the moon. Furthermore, we did so with computers that were so primitive, so backward. They were much slower, much worse than, say, the computer in my iPhone right now. Not by a little, but really by a lot. So it was in a way a very primitive time. Now let's fast forward to the current day. President Trump and the United States government have talked once again about putting a man on the moon. Trump, it seems, would like this as some kind of accomplishment. And here's the amazing thing. We're not actually sure that we can do it. It's possible we could do it if we spent many, many times more money than we did in the 1960s. But currently, the United States government does not have the capacity, the practical capacity, the talent, the institutions, the plans to put a man on the moon, even though as a country, we are much richer, we have many more scientists, we have plenty of potential qualified astronauts, and we have computing power that is really just phenomenal and immense. And yet perhaps, maybe, we're just not able to put a man on the moon. So something has evolved in the nature of American government. And I think something similar is true for many of the other Western governments. And that is the capacity to get things done is weaker than it used to be. So economist Paul Krugman, he once described the US federal government as a big insurance company attached to an army. When he made this comment, he meant it more or less as a positive. It doesn't seem like a positive right now, but in essence, what Krugman was saying was, well, the United States, it has a large military. We all know that, right? And the United States has a massive social welfare state. We have programs for the poor, for the elderly, for the young. We call these Social Security, Medicare, Medicaid. And with those programs, the US government is really very good at cutting checks, reimbursing people. It serves in essence as a kind of insurance company, though often It's an insurance company that gives money to wealthier people rather than poorer people. But nonetheless, it's an insurance company. If you look at the governments of Western Europe, often they are not even an army plus an insurance company. They are just the insurance company. They have done away with the army because they want to spend more on the insurance company. Now, if all your government is an insurance company, that government really will not be that great at getting things done. Now, under normal circumstances, in fact, the US federal government does not need to get all that much done. The military does what it does, whether we like that or not. Maybe we're not good at putting a man on the moon. It's not obvious what the marginal value of doing that would be. And under normal times, well, the private sector, your state and local governments, they get some amount of things done. And yes, the federal government plays out its role as insurance company. So now, of course, the coronavirus pandemic has come, and this is a kind of reckoning that if you have a government that is just insurance company, it turns out that it's very bad for you because you need to get done a lot of planning against the virus, and the United States government has done a poor job of that. So if we look around the world, we can see at least 3 countries that have done a pretty good job of protecting against the virus. Not a perfect job, but pretty good. And they all responded early. And those governments would be Singapore, Taiwan, and South Korea. And they have a few things in common. One thing they have in common is just a very competent bureaucracy. They also have in common a deep understanding that threats can come from China. They are very alert as to what is coming from China. They have long-term time perspectives. And all 3 also are countries, they do not assume they will simply be there on the ground existing 5 years from now. They are used to existential risk and high levels of threat. They do not consider themselves fully secure as countries. So they always stand somewhat on a kind of emergency footing. And finally, also, they all had experience with SARS, another pandemic, one that was less dangerous, some number of years earlier. So they decided to be ready the next time. So if you put together all those factors, those countries responded fairly well. My own country, the United States, was alerted to the virus, and we spent essentially 2 months doing nothing whatsoever. January, February, parts of March, actually a little more than 2 months. We simply sat around, we twiddled our thumbs. Other countries were gearing up their capacities to do testing or stockpiling masks. But the United States is not the only country that responded poorly. Most of Western Europe did an equally bad job of responding to the coronavirus. And again, you can think of those governments as very large insurance companies. They are good at redistributing wealth, but pretty slow and pretty sluggish. If anything, I think I would argue that Western European governments may have responded worse than the United States government. So just some of the areas we failed in. There are so many areas, I can't cover them all. But obviously masks may be important in slowing the transmission of the virus. The United States government has all kinds of permits about building a mask factory. You need to get permission. The permission can take 2 months. That's a long time in the current environment. Also, it has been difficult to get permits for importing masks from China, China being the leading mask producing company. It is still the case in the United States, one of the world's richest economies, that many of our doctors and nurses are being asked to do their work without a mask. Now, a mask is not very hard to produce. It's not like a vaccine that is problematic. Maybe it won't work. We know how to make masks, and we are still not doing the proper job. And there are so many people individually at home making their own masks. because our government, our state capacity has failed us. Just getting tests done. Who has the virus? Who does not? Who needs to be protected? Who ought to stay at home? Who needs to go to the hospital? The United States has done a poor job getting these tests done. Very poor job. Our government has been paying $50 per test. In Switzerland, they have been paying $200 per test and doing a better job. We have been cheap. Our testing apparatus, it is also regulated. We have made it unprofitable and legally cumbersome for individuals to be trying to do the tests. Some of the quickest kinds of test have just now, I think a few days ago, received approval from the regulators. The regulators were not sure if they wanted to allow this test. In retrospect, it seems they should have allowed it. It's a quicker test. They didn't want to do that. They were not certain. They were risk averse. There were articles saying senior government scientists are not sure and they are waiting. It was the bureaucratic mentality, retreating into the bias of the status quo when there is an emergency raging all around. So even over the course of the last week, the number of tests being performed in the United States has not gone up from the numbers we have. And many of the tests we have, you make people go to healthcare centers where perhaps they will interact with other people who really do have the virus, and our testing apparatus itself, in some cases, may be contributing to the virus spread. So that again is a case where our federal government has been failing. I think there's two areas at least where the United States response has been quite strong. I would say the best in the world, actually. And these are two very important areas. Neither area is our federal government. So the first of those areas has been the US tech companies. If you think about the crisis, we are now mostly at home. We are socially distanced, not going into the workplace. Personally, I do not go to the supermarket. I'm afraid to go to the supermarket. I don't want to get sick, of course. So how do I order my food? I order my food on the internet. Amazon brings my food. Amazon has done an amazing job bringing my food, my books, in fact, anything else I want. I have a high-speed internet connection at home. Of course, with everyone staying at home in the United States, the usage of the internet connections has been so much higher. Everyone is doing a Zoom call like we are doing now. We have Zoom parties. We have Zoom nightclubs. We have people drinking champagne together over Zoom. Maybe that's strange or funny, but that is the new world we live in. And Zoom connections, as you know, they take up a fair amount of bandwidth. With people stuck at home, our movie theaters are closed. So what do people do for visual entertainment? Well, they watch Netflix. That's our streaming company. You watch films on your television, and they're sent to you basically over the internet through cable connections. Netflix streaming, again, it eats up a lot of data, but it's remarkable that the United States internet companies have pulled this off completely with close to zero problems, zero glitches. So a new kind of internet world has arisen to help people be at home, socially isolated. And this new world popped up within days. It's not perfect. It does not have all of the warmth of our previous interactions. But if you ask, has it worked well? Have these companies done what has been expected of them? Has their performance been first rate? The answers to those questions are all astonishingly positive. The tech sector also was one of the first parts of the American economy to see that shutdowns were coming. So when everyone had to work at a distance at home, the major tech companies, they were all ready. They had plans. They pressed a button, the plan went into operation. They were well prepared for this, much better prepared than the United States government. So I would give actually an A+ rating to US tech companies. They've just done remarkably well. Their capacity to be the functioning multinational institutions of our time, effective, knit people together, help them talk to each other, to me has been amazing. And the progress of science has been faster. So in the old days, you would publish in some journal, it would take months to come out, then you would write people letters by hand. But now scientists, they put what are called preprints up on the internet, open access. Other scientists read the papers and there's a rapid dialogue. Well, how good is the scientific paper? And right now, very often within hours, there's criticisms, dialogue, analysis, and people have a sense, how good are these results? How valuable is this paper? In less than a day, if the paper is important, very often within hours. So science is working better than it has been also because of the internet. So what's the other sector of the United States that has responded pretty well to these problems? I would say it is big business in the area of biomedical and also our research institutions. So many companies, philanthropists, institutions, they are working very hard to come up with vaccines. Of course, we're not sure how well this will succeed, but the speed of that effort, again, has been pretty positive. I would not say flawless. The amount of work being done by scientists to come up, say, with antiviral drugs, or to repurpose drugs we already have, or to come up with ways of using the blood plasma from people who have already been infected and use that to cure those who have the disease, antibody treatments. Simply our biomedical companies, motivated by profit, I should add. Also, some of our philanthropists, not a perfect job, but really they have shown a lot of capacity, a fair amount of speed, and whatever remedies we come up with against this virus, it's almost certain the United States will have played a key role in this response process. So there are many people out there advocating for testing, advocating for masks, advocating for contact tracing. In general, I favor these ideas, but I'm also really quite aware my own government is just not very good at doing those things. So it's not really where I am pinning my hopes. I am pinning my hopes much more on the United States biomedical establishment, of course, working with other countries, with Great Britain, with Japan, with other parts of Europe, but the United States taking a clear lead. And if I'm trying to monitor progress on a given day, I'm less interested in counting the number of tests. So again, I fully favor much more testing and much more closely monitoring the progress and speed of science in this area. How much are we coming up with good treatments so that when the lockdown ends, as it must, as it will soon, when the lockdown ends and people get sick, how much better will we be at treating them? I think that is the short run question I am tracking most closely, because we need to be much better at treating them if people will feel the security to go out again and spend money and go to work and behave somewhat normally. At the current death rate, they do not feel that security, and we will be in an economic depression. The world will be in an economic depression for some time. But if we can improve treatment and over the longer run, get vaccines, then I think we actually can approach a world that is coming back to normal. My country has started to make it easier to come up with treatments. So as you might suspect, potential treatments in the biomedical area, they are regulated, they need governmental approval, there are slow, cumbersome bureaucracies, bit by bit, slowly, but actually the United States federal government is working to speed up these processes, to accelerate approvals that that progress is not where it should be, but I think within a few months' time, we will have a much speedier response mechanism when it comes to approving biomedical innovations. And that is one reason why, at least on the public health side of this crisis, I am not an extreme pessimist. I would say on the public health side, I am a moderate optimist. I see a lot of opportunities for progress, and I think those will be coming to us, probably coming first in the United States. In the meantime, politics and government in my country, it is still evolving. It is evolving very rapidly. One feature of the United States, as of course you know from its name, is federalism, right? We have autonomous states, 50 of them, just as India has states with their own governance powers. And what's happening is that in areas where our federal government, the centralized government, has failed, particular individual states are taking the lead, taking the initiative, showing greater state capacity, innovating, coming up with new policy plans, trying to figure out what to shut down, when to reopen. Not all of these governments are doing a good job. If you look at Louisiana, you look at South Dakota, it's pretty terrible. If you look at Hawaii, it's pretty good. If you look at Maryland, it's pretty good. If you look at New York State, I would say it's pretty mixed. If you look at California, it's been decent. Washington State, quite good. But the point is, we have 50 different laboratories for what government can do at a more local level. And I think the more successful states are examples or role models, and the other governments can learn from them. And I am starting to see this happen. So the powers of American government at the level of the individual states are coming back in a way that had not been so active for a long time. So the name of my country, calling it the United States, that word states is a plural, of course, 50 of them. That's taken on a new and different meaning in this crisis, in some ways more like its original meaning from the time of the founding of this nation. So again, I very clearly see a lot of state governments are doing bad jobs, but there's a lot of progress at the level of state and local government. And that's an area where I'm more hopeful than expecting my federal, national, centralized government to just get its act together, because I don't quite see that happening. Also in my country, the response of the federal government has become a polarized issue. President Trump is very controversial. So people who hate Trump say, oh, our response is terrible. People who like Trump say, oh, our response is really good. To me, that is a fruitless, misleading debate. I don't think our response has been good. I'm not sure how much of that is Trump's fault. When I look at Western Europe, most other countries which do not have Trump as a leader also have had a poor response. I would just say there is something in the nature of current governance that we are not good at sending a man to the moon. Western democracies are not good at responding to a virus pandemic, and that includes the United States. But there are these other areas for optimism, the big tech companies, the biomedical establishment, federalism, and the response of some of our individual states. So yes, there's a great deal we can do. I would like to close my remarks just by, trying to inspire all of you to, do what you can in this area. It is not hopeless. How good our response is up to us. It is not just up to our centralized government. Put aside whether you like or dislike your centralized government and wake up in the morning, every morning, and just ask yourself, how can I be a piece of this puzzle? How can I do something to make this pandemic less bad? And so when I am older, I will look back and say, when that crisis came, I stood up for my nation, stood up for my world, and did the very best I possibly could. Thank you all for listening, and I believe there's a small amount of time for questions, but anyway, that's the end of my formal remarks. Thank you.
Thank you so much. The first question is regarding China. It's how should nations in the future be careful from China in trade, various deals and agreement, and from such kinds of biological diseases?
Well, I think with China, first of all, China has too large a share of the world's manufacturing of pharmaceuticals and medical supply equipment. So the United States needs to bring the production of those items back into the United States. And we are capable of doing that. We are a wealthy enough country. We have the technologies. It will cost us more to make it in the United States. I fully understand that is somewhat inefficient, but we need access to those items when there is a pandemic. And that we can do, that we can control. For the most part, I think China does many irresponsible things, continuing wet markets where animals are sold, right, in Wuhan and many other parts of China. That's terrible. I'm not sure that we as outsiders can control that. So many things that China does, we as outsiders cannot control very well. And if we try to twist China's arm, the Chinese citizenry becomes more patriotic, they react negatively, and then it is harder to get that change. So I think much of what goes on in China, we simply don't have a say. Of course, much of it is not good, but we need to be patient and hope that the Chinese Communist Party will fix at least some of it. In the meantime, there are some ways we can protect ourselves more, but anyone's power to influence China, unfortunately, is extremely limited.
On that sobering note, the next question is regarding President Trump and the WHO. Has he been correct in withdrawing funding to WHO?
If I were President Trump, I would not withdraw funding from the WHO right now, because we are in the middle of a crisis. And the WHO, for all of its flaws, in my opinion, is needed. But that said, I think Trump's opinion of the WHO is essentially correct. It panders far too much to the Chinese. It performed very poorly throughout this pandemic. And once the worst of the current moment is over, I absolutely would pursue a policy similar to that of President Trump. So I think in principle, he is correct. I don't agree with the timing. I think we simply need some forbearance on that one.
Thank you. The next question is on the lockdown. It says, after the lockdown, there would definitely be apprehensions about the public wanting to spend money. What should a state do to stimulate the economy?
That's a very big question. So during the lockdown, there are many small businesses that are running out of money, and you would like for them to have some kind of liquidity cushion. And many governments around the world are supplying that cushion. The United States also is doing that. We're not doing a good job of it. I'm fine with the policy in principle, but our ability to execute, as you might expect based on my earlier remarks, has been very poor. We just don't have a good way of getting money to all of those small businesses. So that policy so far has been a failure. Now, I think in the longer run, for reopenings to work, people have to feel secure. So you need to have some better treatments for sick people in some manner. I think there's a common trend in the history of my country. I suspect it's true for every country. But when a new risk comes along, at first, people greatly underreact. Over time, as the risk becomes more visible, eventually people overreact and go crazy with fear of risk. So at some point, we will reach the stage in this pandemic where people are overreacting. At some point, a lot of these public spaces will be pretty safe. Nothing is perfectly safe, but people still will not go. So we will need clear leadership, risk communication, trusted public health sector institutions. Right now, we don't have that. I hope we get it in time, but leadership will really matter, and what you do as an individual to communicate your understanding of risk to the people you know will matter as well.
Thank you. So how can governments be persuaded to pursue more liberal trade policies, given that some countries' action or inaction harms the entire world?
Well, right now we're shutting down trade in a lot of kinds of medical equipment. Many countries in the world won't allow medical equipment to be traded. And this is making virtually all countries worse off. If people could trade more supplies, everyone would have a better medical supply chain. But right now there's a kind of panic. I don't know how to persuade governments to do this. No single government wishes to move first. I would just say, let us continue to speak the truth about the benefits of having free trade in most areas. I'm not sure that message will get through, but to lay out with specifics and great clarity how if we are able to trade medical supply inputs back and forth, both say India and the United States and Canada, Western Europe, many other countries can do a better job taking care of their peoples.
That's actually a very good suggestion. What are your views on e-services impinging on privacy at this time of the pandemic? India is pushing an app called Arogya Setu, which means health bridge. Should people compromise privacy in times like these in order for the greater good?
That's a very difficult question. I've been thinking about this a great deal. My inclination is to favor such services because I think it has been shown in South Korea and Singapore that they can be effective in fighting back the pandemic. But I think I need to relate my full thinking or my full calculus on this matter. In my view, the track we were already on, people were losing more and more privacy to begin with. So these apps, they will accelerate that trend. But I don't think it's fair to blame them for privacy disappearing. I think that was happening anyway. So my tendency is to favor them for their public health impact, to be concerned about the privacy issues, to try to build in anonymity up front, to try to build in safeguards so some of it will dissolve when the crisis is over. Am I entirely sure that's the correct answer? No. But that's the track my thinking has gone on so far to date.
Thank you. The next question is on African countries. It's what are your views on a potential loan bailout for African countries by the IMF?
Well, African countries many of them have accumulated quite a bit of debt in recent times. This is not always widely known. Historically, a lot of Africa was a low debt region, if only because people didn't want to lend to those countries. But African debt has been growing. So I would favor some notion of waiving a lot of that debt, just writing it off, a debt jubilee, saying they don't have to pay us back. And the wealthy countries could do that overnight, simply with an announcement. It would not require a complicated bureaucratic plan. It would help those African nations. I would like to do a version of that. I would do that before I would look to the IMF for a complicated bailout plan. The simplest bailout is just to tell someone, keep your money. So I say, let's do that first, monitor the situation, see if anything more is needed. But the IMF, I am not sure at the current moment, will be very effective in responding to what is essentially a crisis in almost every country at the same time. I don't blame the IMF for that. It's simply a kind of impossible job.
I see. So the next question is on China. It's, do you believe economic isolation would be a wise step? And if we believe China is too big to fail or too important to be isolated, how can China be kept in check?
Again, there's so many questions embodied in that sequence. I think right now, China is in a very vulnerable position. Their economy is shrinking. Levels of debt in real estate, municipal governments are very high. It's possible when China feels vulnerable, it is more dangerous on the foreign policy front. So I think Taiwan should be worried. The chance of some kind of conflict between the US and China, or even China and India, is probably higher right now. I'm not sure either the United States or India can do a great deal to ease that situation. I think with China, it is good to be strong, but not obnoxious, not aggressive, to be predictable, to be firm, to be calm, to have open lines of communication, to try to set a good example, have China respect you, but do not overestimate how much you can accomplish with China. Those are my general inclinations. But as I said before, I just don't think we have that many policy levers when it comes to China.
That's a pretty realistic kind of explanation of the situation. There's another question on poor people. What kind of policy should countries adopt to ensure that another pandemic does not leave the poor at a great disadvantage, like migrant workers being stuck, daily wage workers being unemployed?
That's a very good question. In part, the answer depends on which country you are. Different countries are in very different positions. But simply the notion of being prepared for a pandemic with a public health infrastructure that can do testing quickly, that can distribute masks quickly, that can distribute aid quickly, that has surge capacity in its hospitals and in its clinics. And if you are prepared in advance, you will not eliminate those problems with poverty, but many things will go much smoother for you than otherwise. So as I said before, Taiwan, Singapore, South Korea were fairly well prepared. They've had a much better response, much lower casualties, less economic damage. It is possible to do that, right? It's not an impossible task. More countries should do that. But I would stress the details of the preparation depend on the country. I cannot tell you in any detail what India should do, but I'm fairly certain it's quite different than what, say, the suburban parts of the United States should do. We have much more room, for instance, in the suburbs, a very different setting.
How is the US government accelerating its speed to provide approvals and permits related to making testing available to people who are poor?
Well, we're trying to make testing more available to everyone. Unless you're very wealthy, even a well-off person in this country can have great difficulty getting a test. You could be a millionaire and you could still be unable to get a test. So our failure in testing is not just testing for the poor, it is a failure across the board. One of the problems we made is the different chemical elements you need for testing. We did not buy those up quickly enough. We waited too long, and other countries have bought up what is available. We need to be stepping into the marketplace and offering more for tests, offering more for those elements. And to some extent, the market will in fact figure it out when the demand is there. We have been cheap. We have over-regulated tests. We had no plan in advance. We had bad coordination. We have done so many things wrong when it comes to tests. Even when we unpack, say, 2 or 3 of those problems, our testing capacity still has not really shot up the way it should have. So we have much more work to do. It's not just a single problem with a single solution. There are multiple blockades or bottlenecks that stop us from doing more testing for everyone, not just the poor.
So staying on the poor, there have been many reports on how this pandemic has impacted minorities in America disproportionately. Would you be able to dwell more on these glaring inequalities that have been thus exposed?
Well, I think there are several reasons why it has been more dangerous for Blacks and Latinos. One is simply those individuals are more likely to be working in face-to-face service jobs, so they cannot just telecommute and retreat to their homes or apartments, right? They're out there in the public space. Another factor is it seems coronavirus is much worse for people with hypertension, diabetes, and obesity. And those groups have higher rates of all of those phenomena. So it is more dangerous on average for Blacks and Latinos. Of course, this illustrates that if you have long-term problems in your public health system, such as vulnerable groups, high rates of diabetes. Diabetes in India is very high. I'm sure you all know this. When short-term crises come, those long-term problems make you much more vulnerable. So the real learning here is your long-term problems you need to address really right away. You just can't sit on them for years and years and years. it will come back to hurt you in a very bad way. And of course, with a contagious disease, the victims turn out to be virtually everyone, not just the immediately affected individuals.
That's right. What are your views on governments fudging the data on affected deceased people from the pandemic?
A lot of governments have not been straightforward with people. China was the biggest liar. Probably they are still withholding the true number of cases. My own government was not straightforward. I don't think it was mostly deliberate lying. I think it was incompetence and complacency and a kind of self-deception and denial that this could actually really be happening. So we need leaders who are willing to look reality in the eye and face up to what might be unpleasant consequences for their reelection or their political party, and speak the truth and be credible and not look for shortcuts. So a lot of the biggest problems, I don't think it's deliberate lying, but it's people lying to themselves and not pursuing the truth with a full vigor.
So on the same similar point, there's a question that, do you believe this pandemic will impact progress made towards globalization in the last few decades? As in,
It's a massive setback for globalization, most of all immigration. So countries have closed their borders almost completely. When those will reopen, no one knows, but I think it will take a long time, and it may never go back to how it was.
Okay. Do you think there's a question on the EU bloc? It's actually quite a dire question. Will the EU bloc survive post the pandemic?
If you look at the response of the European Union at the level of the European Union, it has been very weak, almost non-existent. Risk sharing weak, public health plan weak, money spent weak. The big star has been the European Central Bank, but the rest of the EU out to lunch. The national governments have responded in different ways, but it's striking how much the response has been national and not pan-European. So I don't think the European Union will vanish, but it's just obvious how weak it is, and it will become more and more an entity on paper that does not make really the key decisions, and that's already quite obvious. That's not even a prediction, that's just a fact.
Okay. Do you think there will be an impact on global military spending?
That's hard to predict. I think any volatile situation creates new risks. So I hear many people claim that the situation in Iraq and Iran is now more dangerous. I don't have the personal expertise to give you my own judgment. I'm just saying I hear that quite a bit. The situation with China and Taiwan seems to be more dangerous. That said, all of our countries are poorer. I don't know that we have the money to spend more on defense, but I do think it is now a more dangerous world.
How will this, we talked about the Middle East, how will this affect US oil companies when compared to the recent OPEC decision?
Well, US oil companies are much poorer. The last I checked, the price of oil was below $20 a barrel, and not too long ago, it was $60 a barrel. That's a phenomenal change. It's actually bad for climate change, bad for pollution, good for consumers, good for people who heat their homes. But it's a big shock for countries such as Mexico that export fossil fuels. There's a chance Mexico will become insolvent for this reason. Also parts of the Middle East. So it's another major shock to the global economy.
So moving on to a different topic on education, how do you think this pandemic will affect education of school students and college students?
Higher education is one of the biggest losers. As you know, India, Pakistan send so many of their smartest students to Oxford, to Cambridge, sometimes to the United States. These immigration clearances will be very hard to get. It will be much more cumbersome. People will be also less willing or less interested in leaving home. So there will be a fiscal crisis in higher education because so many foreign students will be cut off. Those schools right now have to restructure, make cuts. They've eliminated plans for expansion and more hiring. And this will be a very grave situation, especially for schools that take in foreign students. So it's actually much worse for Oxford and Cambridge than it is for, say, Harvard and MIT, because the British schools rely more on foreign students.
How will it affect George Mason, for example?
George Mason will be relatively robust. Of course, we have foreign students, but quite a few of our students come from the local area, and they will continue to go. And many people from the local area who might have, say, gone to study somewhere distant, I think will now go to George Mason. We will have to tighten our belt, but I think we are in a much better situation than most other schools.
That's good to hear. There's a question on universal basic income. So do you think that schemes like UBI should survive the pandemic and become a permanent feature of government fiscal policy?
Well, again, I think you have to ask which government and under what conditions. Most governments in the world don't have the resources to do UBI permanently right now. You can favor additional transfers, that's fine, it's case-by-case judgment, but the best UBI we could give people right now would be to fix the whole coronavirus thing and make everyone safer again. And that would also bring our economies back to life. So all available resources, I would channel toward that end at the moment. And then when that's done, see where things stand.
Anas, do we have any more questions?
Well, I would just say thank you for hosting me. Again, I appreciate the work you're all doing, and please keep it up. And an honor for me to speak to your group.
Thank you so much. It was actually our honor to hear from you, and it's been very, very interesting and illuminating.
And good luck to everyone. We can beat this thing back. We will do it.
Thank you. And thank you once again to everybody who's been listening in. And apologies once again for the small glitch in the beginning.
Okay, thank you. Take care. Bye.
Bye-bye.